First, Brazil had to endure an explosion of dengue fever. Then the same mosquito delivered the Zika virus. Now officials are scrambling to address a new health risk. Dozens in Sao Paulo have died of H1N1 virus, also known as the swine flu. CCTV's Paulo Cabral reports on how Brazil is confronting this new and unexpected public health challenge.
Long lines for vaccination in Sao Paulo. The result of a new virus outbreak and new fears. This time it's the H1N1 virus, also known as swine flu. Across the country, it's killed 102 people since the beginning of the year, most of them in Sao Paulo. With so much attention of late focused on the Zika epidemic, this H1N1 outbreak, beginning during the southern hemisphere summer, caught many people off guard.
We don't really know why this happened. The influenza-type viruses are very unpredictable, but there are some hypotheses. For example, it would have been brought by people who traveled to the northern hemisphere during winter. There was much H1N1 activity in the United States this season, for example.
Health authorities ramped up the yearly vaccine campaign to try to deal with the outbreak ahead of winter.
Mothers are desperate because we have a runny nose and already think the worst. So we have to bring the kids for vaccination. It's a disease with heavy symptoms that can leave lasting side effects. We have to come. It's a no-brainer.
Vaccination against the H1N1 virus is free through the public health system for those considered most vulnerable, like infants and the elderly. For everyone else, immunization costs about $30 in private clinics. And there's no shortage of people willing to spend this money to get protection against the virus.
Many private companies also sponsor the immunization of their employees to stop the disease from spreading in the workplace, which should cost them much more in the long run. Cristina Bellinassi came with her 2 children and her housekeeper to get shots, all to make sure home is a safe place.
What we hear is that this is not like any regular flu. It's a dangerous disease that could even kill if you're vulnerable. It's not our case, but I think that if more people take the vaccine, it will be easier to stop the spread of the virus.
Millions of people are getting their injections in preparation for winter, when it's easier for the virus to spread. But the cost factor will still leave large numbers of Brazilians unprotected through a season of uncertainty. Paulo Cabral, CCTV, São Paulo.